children spend about 30% of their time in school environments. It's during that period of their life when they are, they're growing, they're vulnerable. Those exposures that happen in childhood live with them for the rest of their lives. And a school environment should be a healthy environment. It should be a safe environment. It should be, something that you can rely on to provide a good educational environment. And we know that air quality, we know that infection rates in schools and things affect not just health, but affect educational outcomes. And that then, doesn't just live as a health effect with the child for the rest of their life. It lives with them in terms of their educational outcomes, their job prospects, and it affects society. So I just think it's a huge area that we should be thinking about. How can we give the best to our children and young people at the earliest stages of their lives? Yeah, so I've come here to talk about air cleaners in schools, predominantly from an infection control perspective, but also thinking about air pollution in schools and thinking about how we get the evidence we need to support how we can use those in schools, because it's not easy. It's very easy to sort of do a simple model and say, hey, look, an air cleaner will benefit. And yeah, it probably will. But actually to try to explore how we get some of those real world evidence from school-based studies. And I talked a bit about the Class Act study, which we've been running with schools in Bradford and we ran during the pandemic, and put both HEPA filter air cleaners and air quality monitoring in schools, as well as explored UVC-based air cleaners in schools. Yeah, infection outcomes, I mean, that's an interesting question. And one of the things I touched on in the talk, which is, what is your outcome? Because I'm interested in, does it reduce transmission of infection? But obviously for school, they're probably more interested in, does it reduce illness absence? Because they're scored on illness absence. So, thinking about those two things, and we did look at illness absence as well as air quality parameters in that study. Yeah, so we did that study during COVID and we're still trying to publish it, so I can't give all the detail of the outcomes. But what we did see is, perhaps as you might expect, that the air cleaners reduce the concentrations of particulate matter in the school. So that gives you an indication that they're doing what they said they should be doing to the environment. They didn't substantially change the ventilation rates. Again, you wouldn't expect that, but it does tell you that the schools with air cleaners and schools without air cleaners had a similar ventilation rates. And we did see some reduction in illness absence because in the schools which had the air cleaners in there. But I can't give you the actual numbers yet. So it's interesting. We measured particulate matter, but not as a marker for infection risk. It was a proxy for, are the air cleaners doing what they say they're doing? There is potential that has other co-benefits as well. And we haven't looked at that. It wasn't in the original study design, but we are hoping that future funding might allow us to go back to some of the data and explore some of those things in more detail. So, for example, things like absence due to asthma, or whether schools see any other benefits in there as well. Setting up a study like this isn't easy, because you have to have quite a large number of schools to get sufficient amount of data. That means you're engaging with all those schools, and schools are busy places. To be honest, our research project study is not their top priority by any means. So first of all, you need that engagement. You need people on the ground who can go in, who can interact, who can explain the studies with schools. There's quite a big capital cost, because you need your devices, you need all your air quality monitors. I mean, we're measuring air quality in, I think it was 335 classrooms. So that's a lot of monitors you need, and you're collecting data continuously over a period of several months. So there's a lot of resource needed for that. And then I think there's a lot of co-founders as well. You in an ideal world, you'd pick, two groups of schools that were perfectly matched, but they're not, because they will always have architectural differences. They'll always have differences in the demographics of their pupils. They'll always have size differences. We can match them as best we can across the groups, but we know that they're never going to be perfect. And I think, that's a challenge. And then, of course, what happens in the school, and it would be inappropriate to monitor to the nth degree what people were doing with those air quality monitors and keep interfering, or what people were doing with air cleaners. So you kind of have to put them in and leave it, because that's real world. But some schools will turn devices off, some schools will operate them differently, some of them will move them. We saw some really weird stuff as well. Apparently when in a really hot period, with the schools that still had the HEPA filters in, they turned them onto turbo because they realised they could use them as fans to keep the classroom cooler. So there's little extra benefits that we never thought about when we set it up.